All right, in this morning's health check, some doctors are pretty excited about this. A low-cost, widely available steroid is now being used to treat some of the most serious cases of COVID-19. So the drug I'm talking about is called dexamethasone, and this news is coming from a major clinical trial in Oxford, England. It was shown to cut the risk of death by a third for patients on ventilators and reduce deaths by 20% for those on oxygen. And here's why it's of particular interest. Treatment can be made available for just $1 a day. Researchers found the drug does not seem to help patients with mild symptoms. A just published survey of 4,000 Americans shows that this pandemic is really taking its toll in a lot of different ways. It found that 61% of folks feel more stressed. 37% say that stress has led them to eat more. 64% have been spending more time with their partner, with less than 31% wanting more intimacy. As for coping strategies, gardening, exercising, and watching TV on that survey all scored high. A lot of people are also finding strength in friendship and faith. So we are asking you this morning, what's getting you through all of this? You can tweet us, use that hashtag #IamUp. One way to cope is through something called self-care. And since it's Wellness Wednesday, I wanted to touch on skincare routines specifically. Board-certified dermatologist Dr. CORINNE ERICKSON was kind enough to help us out and wake up early this morning. So Dr. ERICKSON, good morning. Thank you so much for joining us.
Good morning. Good morning, Sonia. Thank you for having me.
Yeah, so you and I have talked about this, a lot of us working from home, and when I do, it's like less makeup, natural hair, which has all felt good, but you still got to go through that morning and evening skincare routine. So for people who aren't quite sure, what does that look like?
Absolutely. So it's important to start and end your day with a nice, gentle cleansing regimen. It doesn't have to be anything harsh or abrasive, just a good cleanser to get the oil and dirt and sunscreen off twice a day. I also recommend with, all of the dog walks and taking the kids around the block, you definitely need to make sure you're incorporating your broad spectrum SPF of 30 or higher every morning. And I like to pair that with an antioxidant serum first. It boosts the impact of your SPF, and it helps to fade out some of those unwanted dark spots that we get from time outdoors. Additionally, incorporating something to just make you feel a little pampered, like a mask once a week, as long as it's not irritating for your skin. Some people love the jade rollers, just something that makes you feel good, that's harmless, and just like you're just taking care of yourself.
And so when you talk about a good cleanser or a good moisturizer, are there ingredients that we should be looking for? Like what makes something actually good for us?
Sure. So just something gentle like a Cetaphil that doesn't have any added fragrance. Oftentimes I look for more of what's not in a cleanser when I'm making a choice. So I like to stay away from most patients from things that have just gritty jojoba beads. Those can actually get caught under your eyelid and cause irritation. So I like to use just a basic Cetaphil, CeraVe gentle cleanser, nothing fancy. But then if you want to add a little something to lighten and brighten, something with a glycolic acid or a salicylic acid a few times a week can also add some benefit.
And what about exfoliating your skin? Is that something we should be doing every day or every other day, or how often?
So you can definitely overdo that, and that can cause little micro tears in your skin. So pay attention to what type of exfoliant you use. I recommend patients use an alpha hydroxy acid, like a glycolic acid, to more chemically remove the dull skin cells, rather than something that has grit to it, like ground walnut shells or jojoba beads that are in a lot of the more abrasive exfoliants. Those can cause micro tears in the skin and cause a little bit more damage than good.
Okay, I'm going to go home and get my at-home facial regimen on. Dr. ERICKSON,
okay.
Thank you so much. We really appreciate it. And Greg is going to take it from here.
Did she say ground walnut shells?
Yeah, she did.
People rub that on their face?
Isn't that?
I'm going to go home and exfoliate.
I want to see the before and after, Greg. Greg's about to have a birthday. Am I allowed to say that? So we're trying
You can say that. Just don't say,
Not going to say anything else.
I'm 35 again. I will be next week again.